we can proceed further with radiology imaging, and it will be a little bit different radiology. It will be nuclear medicine and prostate cancer detection. And I'd like to invite Dr. Sigitas Tiškevičius, again from National Cancer Institute, to present us the new things in this field. What can we do? Hello, Sigitas. Are you with us?
Hello, can you hear me?
Yeah.
Hello.
Yeah. We can hear you.
So,
yeah. So
okay, shall we start?
Let's go and start your presentation about what can we do for prostate with nuclear medicine.
Okay. So, dear colleagues, let me introduce myself. My name is Sigitas Tiškevičius, and I'm a radiologist working in nuclear medicine department at National Cancer Institute. The topic of my today presentation is nuclear medicine in prostate cancer detection. And tomorrow and on the last day of the conference, there will be 2 lectures about PSMA PET presented by my colleagues from Riga and Tallinn. So I focus on the nuclear medicine imaging beyond PSMA PET. And let's start with conventional nuclear medicine. And the most common examination in bone scintigraphy, or also known as bone scan. This is summary table from prostate cancer guidelines of European Association of Urology. And as we can see, in intermediate risk disease, a high risk localized disease, local advanced disease, we may find bone scanned and cross-sectional imaging of abdomen and pelvis as well. The clinical indication for bone scan in oncology, of course, is bone disease, bone metastasis, present or suspected, especially for solid tumors with high affinity for bone, such as prostate cancer. The second indication is treatment monitoring. And in nuclear medicine, we have an option not only to assess the images visually, but also to perform some quantitative evaluation. For example, we can use one of the commercially available computed systems, such as bone scan index or BSI. The bone scan index is the percentage of the metastatic affected bone related to the whole skeletal mass. And here we can see an example. This is the same patient and 2 scans of the same patient. The red dots are metastatic affected bones, and we can see that bone scan index demonstrate worsening of the disease, cause the percentage of affected bone increases. Another novel technique is quantitative bone SPECT. From the SPECT CT images, we can calculate the radioactivity concentration. It's similar like SUV values in PET-CT examination. And all the modern gamma cameras, SPECT-CT gamma cameras, they are capable to perform such calculation. Also, the gamma camera we are using in our nuclear medicine department, we also sometimes perform the quantitative bone SPECT. Also, we have to perform bone scan before or prior to radionuclide therapy of bone metastasis, because the tracer or agent used for bone scan, the uptake pattern of this agent is similar or same like radionuclides used for therapy. So we can predict the uptake of radionuclides used for therapy or perform some dosimetry calculation. When we are talking about bone scintigraphy, we have to keep in mind that this is imaging of bone metabolism or bone turnover. And the metastatic site exhibits increased bone metabolism, so we can image the metastasis and see on the scans as a hot spot. And we have a dozen of different imaging modalities for prostate cancer. Is CT, MRI, PET with different tracers. And we have to keep in mind that all these modalities images different effects. So sometimes we see the discrepancy when we look at the radiology reports. And this is one of the examples. We have prostate cancer patient who undergoes initial staging. On the left side, we can see the very nice, crispy bone image of CT. And the report states that there are 4 lesions in skeleton suspicious for bone metastasis. And on the right side, this is SPECT CT of same patient. And here we can see multiple bone metastases as hot spots through whole axial skeleton. And as we can see, we can image the changes in bone metabolism earlier than they appear on anatomical images like CT. While performing bone scintigraphy, we can image the patient using different protocols. For example, planar whole body imaging, or we can do the tomographic examination, also known as SPECT, single photon emission tomography, or we can combine SPECT with the CT imaging and look at the fused SPECT CT. And this is example of whole body planar images in anterior and posterior projection. It a bit resembles X-ray images in 2D dimension. And here is an example of SPECT image. It resembles a bit computer tomography. We look through the images in 3 planes, and also we radiologists or clinicians like this rotating or multi-intensity projection images. And nowadays, most of the gamma cameras sold in the market are SPECT CT. This means that such a scanner combines the gamma camera itself, and also there is computer tomography built in the same gantry. And here is an example of bone SPECT CT imaging. We can see the CT image with fused or, let's say, superimposed SPECT images over. So the color scale is SPECT image and the grayscale is CT. So if we look back at the prostate cancer guidelines from European Association of Urology, in the staging chapter, we may see that the sensitivity and specificity of the bone scan doesn't look very impressive. But if you look at the reference, this is the meta-analysis from 2014 published in Skeletal Radiology. Those figures are from plain whole body imaging, and this is not the figures which responds to SPECT or SPECT CT. So is the bone scan only planar whole body imaging? I am a bit cautious about that because The current standard for bone imaging is the whole body SPECT-CT imaging, or at least SPECT. And all nuclear medicine department in Lithuania, they all are equipped with SPECT-CT scanners. And as far as I know, all the departments in Lithuania are using the SPECT-CT protocol for bone imaging. And this is data from more recent meta-analysis from 2020. And if you look at the sensitivity and specificity of a whole body SPECT-CT, so it's above 90%. During the next day, there will be at least 2 lectures about PSMA PET. But there is an option to perform PSMA imaging with conventional gamma camera. PSMA PET has advantage over the SPECT imaging as the resolution of the spatial resolution of the PET-CT is higher than SPECT. But PSMA PET is expensive examination and not available in all PET centers. So the PSMA SPECT imaging may address this problem because the SPECT imaging is not so expensive and even may call it cheap. And technically, it can be done in every nuclear medicine department. At the moment, there is no PSMA SPECT tracers available in European market, but our department has participated in clinical study, and we have the experience with PSMA SPECT imaging. We received the tracer from states-based pharmaceutical company called Lantheus. And this agent is finishing clinical trial phase, and we hope that it will be registered in European market and it will be available for clinical studies. And here is example of PSMA SPECT imaging from our clinical study. This is whole body imaging showing the physiological distribution of PSMA agent. It's physiological high uptake in salivary glands, in kidneys, then there is any abnormal findings. This is another example of the patient undergoing initial staging, and it's biopsy-proven prostate cancer 5+4, and PSMA SPECT images shows a lesion in prostate gland, very high uptake, and pathological lymph nodes on the right side pelvis, in para-aortic region, and also pathological lymph node in the lower paratracheal space. And a few weeks later, this patient underwent the PSMA PET scan, and the findings of PSMA PET were identical to our study. And this conference is online, and actually we can't meet at our nuclear medicine department. So this is the last slide with short presentation of our nuclear medicine department. We have 2 SPECT scanners. One is SPECT-CT, and we perform around 6,000 examinations per year. Also, we have a therapy unit with 12 beds, and around 500 therapy procedures are carried out every year, predominantly by radioiodine therapy of thyroid cancer, followed by radium-223 treatment of bone metastasis. So, thank you for your attention.
Thank you, Sigitas.
You're welcome.
Yeah, I don't see any questions, so I invite everybody to be more active and to ask questions on the Slido platform. As actually it's sometimes looks like that we are talking one to the other, not to the audience. So really be more active and ask these questions to us. And I have a question to you, Sigitas. How do you think how can we improve our nuclear medicine equipment, or maybe these radionuclides? Maybe we need something new things to improve prostate cancer diagnostics and maybe treatment in this field. What's your opinion?
Thank you. I think that the major step will be in PSMA PET studies. And we know that in Kaunas, in second the largest city of Lithuania, there is cyclotron project, and we hope it starts in a year or two. So the tracers for PET will be available in Lithuania, more available. So this is the question of PET scanner. The next step after PSMA PET, I suppose, is theranostic. We have this PSMA PET imaging agent. They are labeled with diagnostic radionuclides like gallium or fluorine, but there is an option to label PSMA molecules with radionuclides for therapy. So it's theranostic, it's imaging with same, let's say, contrast agent, and to perform treatment also with same agent but with different radionuclides. And PSMA theranostic or therapy, it's already started in Germany. It was developed, I suppose, in Freiburg. And at the moment, you can go for commercial treatment, PSMA commercial treatment in Germany. So I suppose the next steps are PSMA PET followed by radionuclide treatment, targeted radionuclide treatment.
Okay, thank you very much.
You're welcome.